So there are multiple considerations for end-of-life ethics, and the Church, the Catholic Church, has a very long tradition on this. It's about 500 years old, so the Church has been doing a lot of thinking on these issues. And so obviously life is going to be very important, temporal life, life in time. But it's not the only thing that's important in terms of Catholic moral theology. So the Church has always said that one must use means that are ordinary. So when you're thinking about medical ethical issues here and end-of-life care, you've always got to ask, well, are these ordinary means? Now, what are ordinary means? Ordinary means are any treatment, procedure, or surgery in which the benefit to the patient outweighs the cost to the patient and to the community. And so, well, what do we look at in order to figure out what is a benefit and what is a cost? Well, the Church has said there are things like, what is the hope of beneficial result from this treatment or surgery? So we've got to ask about hope of beneficial results. You've got to ask about the cost in terms of dollar figures to the patient and the community. Because we live in a world of limited medical resources, no one patient can consume all of the resources that the community has. So we've got to consider others when we make these decisions. We've also got to consider the pain that the patient is going to incur, as well as the patient's relationships with his family or her family and his or her community. And additionally, finally, there are spiritual goods that must be considered. So we've got to consider what this procedure or this medicine will do to one's relationship with God. So for instance, patients that are undergoing cancer treatments often will forego chemotherapy or radiation toward the end of their lives, because those treatments can often incapacitate a patient to the point that they are not able to spiritually prepare for their death. And so this is a consideration the Church has said we have to make, because all temporal goods, such as life in time, all those goods are subordinate to spiritual goods, love of God and love of neighbor. So, so when we think about ordinary means, the patient decides where the benefits are, where the burdens are, and as long as the patient has a sufficient level of courage, they make the decision about if a procedure is ordinary or if a procedure is extraordinary. So extraordinary means are all those means, all those medical procedures, surgeries, etc., in which the burdens to the patient outweigh the benefits. And it's also, I should say, the burdens to the patient and the community. Again, we always consider the patient as in a community setting. The Catholic tradition has always maintained that human beings are not radically individual, but they're always in a community of other Christians and other persons. And so the good of that community and other persons has to be considered. So extraordinary means, again, where the burdens outweigh the benefits, those means never oblige. You are free to use a surgery, a procedure, or a medicine that the patient considers extraordinary, but there is no moral obligation to do so. So here we see the difference between ordinary means, where the patient is obligated to use those means, and extraordinary means. Ordinary and extraordinary means are not about treatments per se. They're about what the patient, how the patient understands his or her life in terms of these treatments. So a respirator, for instance, is not always ordinary or always extraordinary. It could be ordinary for a 20-year-old who's in a diabetic coma, and it could be extraordinary for a 95-year-old who is at the end of maybe a lung cancer, a battle with lung cancer. It could become very extraordinary and very burdensome to be on a respirator at that point. So again, the patient is the arbiter, as long as the patient has that certain level of courage to make those difficult decisions.